Good afternoon, everybody. We appreciate your time and attention today. We've been closely listening to what some of the needs and concerns are in the community, and I've invited two people to come talk to us today and give us a quick update. We have Sarah Meese from our Business Development Group, and Darren Carver is with the Weber Morgan Health Department. One of the things we've talked a lot about in these extraordinary circumstances is self-care and how do we take care of ourselves and our families in some of these extraordinary circumstances. We've talked about being a unique community in terms of wanting to help each other and stand each other up and to be calm and really help each other get through this. And so we invited Darren to come in and talk a little bit about some mental health aspects of this and healthcare that we can look at and think about as many of you do. We're communicating with our kids. These are different times, and I have certainly one daughter that gets a little emotional and excitable about some of these things. It's not the zombie apocalypse like she believes it is, but how do we communicate that with our kids and with our families so that everybody can help each other out and to stay calm. So Darren, we appreciate you being with us today and taking the time, and we appreciate what you do. Thank you.
Yeah, no, grateful for an opportunity to come in and share a couple of things with you that I hope are helpful. Again, I'm Darren Carver, and I work for Weber Human Services, and I'm an associate clinical director there, and have been there for about 25 years working as a licensed clinical social worker. And I think the two obvious statements are that right now, because there is so much uncertainty, it's heightened everyone's stress. And in addition to the uncertainty is the amount of change that has occurred in a very short period of time. So we've gone from a place of perhaps 2.5 weeks ago to hearing about COVID-19 in other countries, to hearing about it in other states, to hearing about it in other parts of our community, to hearing about it right here and having schools shut down, having worship services change, having events canceled that are so important, especially to youth and children, work schedules changing. All of that has combined to heighten everyone's stress and increase our susceptibility to anxiety and depression. I think the first thing that's important to know is that just because you or your family members are experiencing some anxiety and depression, that doesn't mean that you have a diagnosable anxiety disorder or mood disorder. Some worry, some fear, some sadness right now are certainly understandable, and we do not want to think that that is so much out of the ordinary for what families are going through at this point. So I think the first thing that we ought to talk a little bit about is what are some of the kind of standard things that we all should be doing with our families and in our interactions to be sure that we are lowering that stress as best we can. The very first thing that will help you and especially your children is be predictable. Be consistent in your interactions with your children. This is certainly a time where children are at home more than normal. You're being asked to perhaps work as a teacher as well, helping them with their schoolwork. But if you can exercise increased patience and focus on how can I just maintain predictability with my family members, that will in general reduce stress and anxiousness. Be responsive. Notice if your child is withdrawing, becoming more agitated or aggressive. Notice that about yourself. We were just talking together here a little bit about the idea of distraction and how turning our attention away from the news, turning our attention to things that are just a good distraction, a healthy distraction, can make a big difference. This is an important time to show affection, increase affection. That creates great stability for individuals, for families. Sometimes we have to reach out right now, especially through virtual means or electronic means, but there's still great ways for us to show affection. And then model calm reassurance. It's important that we look forward to the future with hope and with positivity, because that's the reality. There is a lot of hope and positivity through all of this. If you're panicking, that's going to heighten panic in others. And so calm reassurance makes a big difference. Well, let's take just a minute and focus on COVID-19 specific. When it comes to children, encourage their questions. Don't worry that they're asking too many questions. Help them understand this situation, and just listen. That makes a bigger difference than you know. Just listen. Let them talk about their feelings and validate those feelings. If they tell you, I'm worried that our whole family, something bad's going to happen, you can validate the feeling of fear, but then provide reassurance that's realistic, that's obvious, that we're taking measures so that something bad doesn't happen to our family. Children sometimes best express their feelings through drawing or other activities. Those are good things to be doing as well. I would check back in with your family members on a regular basis. This is a time to stay connected, even though we're honoring social distance. We live at a time when technology is better than ever in giving us access to one another, and to be able to check in often makes a big difference. This may go without saying, but I would encourage you to limit access to news. I would look to sites that provide the facts, not the hype. So limit access to news to decrease your own anxiousness, and stay positive about the future again. Make plans about what you and your family will be doing when things turn to a greater state of normalcy. We need to look to the future. So let me share with you what might be some of the signs and symptoms of anxiety or depression if that were to be long-standing, or those feelings were to become unmanageable. If there are several nights in which a child or you are not sleeping well, and it's lasting for 2 weeks, 3 weeks, and may not even be attached to what we're talking about here with COVID-19, that's simply exacerbating it. Trouble sleeping is certainly one of those signs of anxiety and depression. Irritability for children and youth especially, becoming more, just feelings of anger often arise. Family members may begin to isolate more than they should be. Increased difficulty concentrating, complaints of stomach aches and gastrointestinal issues, and finally a feeling of hopelessness. So those are some of the signs and symptoms. If they're all coming together and they're long-standing, then it's a good idea to talk to someone. Weber Human Services has many counselors available to provide counseling, primarily to those who have Medicaid coverage. However, many counselors right now are available and are offering free assistance. I'm aware of Family Promise of Ogden that provides free or low-cost counseling services, and also most of the counseling right now is being offered through something called telehealth. So there isn't a need to feel like I've got to go wait in a waiting room and expose myself or my family to something. Telehealth has provided a great way to get counseling without having to be face-to-face with the counselor or be right in. It actually allows you to be face-to-face without being together and being in a waiting room. Also important to note that our community has great crisis services. We have a mobile crisis team that can be accessed if you found yourself in a mental health crisis. The number for that is 1-800-273-TALK. Again, that's 1-800-273-TALK, and that will get you in touch with our mobile crisis team. We also have one specifically for children, and that is 1-833-SAFE-FAM. 1-833-SAFE-FAM. If you dial that number, that will get you in touch with a crisis worker who specializes in children and youth issues. So again, a privilege to be here today and talk about this, and hope along with all of you that things do get back to normal and we experience less change and stress going forward.
Thanks, Darren. We appreciate you taking the time. That's really important information as we set our primary focus and goals to keep everybody safe and give people access to as many resources as we have. One of the other questions we've had quite a bit is regarding our small businesses that are being deeply impacted by this, and we've asked Sarah to come in and give us a brief update on what's happening with our business development group and what gives some tools that people can look to help get through this next few weeks.
Sure. Thank you, Mayor. I'm Sarah with Ogden City Business Development, and we have definitely seen the hardship that many of our businesses are experiencing due to COVID-19. And we're working to provide resources that can help. The first thing I want to touch on is our Ogden City business loans. So Ogden City is making loan funds available to help businesses that have been impacted by coronavirus. We will be able to make loans up to $10,000 to help with working capital, so that can help with things like rent and payroll. We'll be offering a 0% interest rate and up to 12 months of deferred payments. We have also been working to streamline our loan application, and we'll be expediting our review process. At this point, our funds are limited, so we do encourage businesses to apply as quickly as they can, and we'll be prioritizing the funding based on the urgency of need. I also want to let everybody know that we are working to obtain additional funding for our loan program, and we absolutely know how important that's going to be to businesses moving forward. Later today, we'll be posting the full program details and instructions on how to apply for our loans at ogdenbic.com. That's ogdenbic.com. We also want to make sure that our businesses are aware of the SBA disaster assistance loans. Additional funding is available from the SBA. The SBA can fund up to $2 million per small business, and they're offering low interest rates through their disaster assistance program. The current rate for businesses is 3.75%, and for nonprofits it'll be 2.75%. Weber County has been approved for this program and should be listed on the SBA website by tomorrow. As soon as we're listed, businesses here in Ogden and throughout Weber County will be able to apply online for those SBA disaster loans. A few other items we wanted to mention. If you do have existing business loans, we would encourage you to check with your lender about deferred payments or other arrangements. Some SBA loans can be deferred for up to 6 months, so that may be a help in this time. We would also encourage you to contact your business insurance provider to see if your policy covers business interruptions like we're experiencing now due to coronavirus. If you have any questions or need any assistance, please contact us at business@ogdencity.com. Our team is here and eager to assist you. We'll also be posting more business resources on the city's coronavirus page as those resources become available. Thanks.
Thank you both for being here. As we've promised, we want to make regular updates as more information becomes available. In the meantime, love each other, be kind to each other. We're all in this with you. We all are bringing families up and everything in this uncertain time, and we appreciate everybody's patience and willingness to work through this and the sense of community that you all bring. So thank you all very much, and we'll bring more updates as they become available.